My name's Jackie Baxter. This is a role-playing exercise for a biopsychosocial. This is my friend and client, Rachel Stalvey, and together what we're going to do is we're going to go through this assessment, okay? The purpose of this is for an exercise for one of my classes, okay? So today's date is March 28th. And our start time is 7 p.m. Alright, so I have your full legal name as Rachel Stalvey. So what brought you to admission with us?
I have a problem with alcoholism and mental illness with depression and anxiety.
Okay. How old were you the first time you had a drink?
I must have been 21.
Okay. And that was your first use?
Yes, ma'am.
Okay. And when did you start noticing symptoms of feeling anxious or feeling depressed?
That must have started before the drinking started. I would say around the age of maybe 16, 17 during those high school years, you know, the high school years that really start making you feel like society is weighing down on you. You have to find a job, you have to find a college, that just kind of put pressure on me, and I think that's kind of where my anxiety kind of started out.
Started developing.
Yeah.
Okay. Have you ever sought out treatment before now?
So I did do a little bit of outpatient therapy with a couple of classes.
Okay. And at that outpatient, what was the name of it?
It was called CARE, Chemical Addiction Recovery Effort.
Okay. And you said that you did outpatient, so you never did inpatient before?
I did not, no.
Okay. Did you go there for alcoholism and mental health concerns?
So I started going at the age of about 16.
Okay.
To try to take care of some of the anxiety I had, and then I left when I was about 18 years old, and then didn't go back, and then I went back at the age of 21.
Okay, when you went back, or during the time from 18 to 21, did you ever follow up with 12-step meetings or anything for alcoholism? Maybe individual therapy sessions?
So yeah, I did a couple of individual therapy sessions. I never went for too long. I did try to go for longer, but life got in the way, and then I got busy and things of that nature. I did follow up with a 12-step program. I went to Alcoholics Anonymous for a while. That seemed to be pretty helpful at the time, and I still slightly go off and on.
Okay. I'm going to ask you a little bit just about your history. Have you ever had a psychiatric break before?
No.
Okay.
No, I haven't.
And what is your current relationship status?
I am living with a partner.
Okay. And do you guys live with anyone else in the house, or just the two of you?
We do. We have another person that is our roommate. Just trying to help the situation with bills and community and friendship.
Yeah, absolutely. Tell me a little bit about your family and a little bit about your friends. Are you pretty close with your family?
I am pretty close with my family. We weren't close up until a couple of years ago, but now we're super close. I talk to my mom almost every day. I see my family when I'm in town. They make it a point, to come out and see me because I travel for work at this point, and so we're pretty close, yeah.
Right. Do you have any children at all?
I don't have any children.
Okay. How would you identify as your sexual identification? Heterosexual, homosexual, bisexual, transgender?
I am heterosexual.
Okay. What was your highest education?
Some college.
Okay. Awesome. Do you have a degree?
I do. I have an AA degree.
Okay. Are you currently employed?
I am currently employed, yes.
Okay. Full time?
Full time, yes ma'am.
Okay. How long have you been employed there?
Since October of 2022.
Okay, and before that?
Yeah, I worked at Journey Pure
Okay,
for 4 years.
so from 2022 to 2018.
Yeah.
Okay, all right. Do you have any history of military service?
I do not know.
Okay.
None of my family does either, so.
For spiritual belief, how would you identify?
I don't really like have a religious sect, but I'm more universal and holistic in that nature.
Okay. I know that you're fluent in English. Is there any other language barriers or any other cultural awareness that I should be aware of?
No, ma'am.
Okay. Do you have anything legal going on, court case or current charges pending?
No, ma'am.
Okay. All right, let's talk a little bit about your substance use history. So you were 21 the first time that you ever tried alcohol.
Yes.
How much alcohol have you been using?
I would say a couple pints a day.
Okay. Daily?
Daily.
Okay. What would you say your use pattern is?
Every day.
Okay.
From the time I wake up to when I go to sleep.
Okay. Have you ever used heroin before?
Yeah.
Okay. How old were you the first time you tried heroin?
22.
Okay. Do you use heroin regularly?
I do, yes.
Okay. How much are you using?
Probably 3 grams a day.
Okay. You're using that daily?
Daily, yeah.
Okay. Do you use intravenously?
I do.
Okay. Have you ever used methadone?
I've not, no.
Okay. Opiates?
Yes.
Okay. How old were you the first time you tried an opiate?
22.
Okay. Do you use opiates on a daily basis?
I do, yes.
Okay. And how much opioids do you use daily?
I would say 4 to 5 milligrams.
Okay. Do you use them intravenously, inhalation, snorting?
All of the above.
Okay. Have you ever used barbiturates?
No.
Okay. Have you ever used sedatives before?
No, ma'am.
Okay. Valium, Xanax, Klonopin.
Yes, ma'am.
Okay. How old were you the first time you tried?
I'm gonna say 21.
Okay. When was the last time that you used Klonopin, Xanax, Valium, or benzos?
I'm gonna say a couple years ago. I was probably 24, 25.
Okay. Have you ever used GHB or GBL?
No.
Okay. Cocaine,
No, ma'am.
methamphetamine.
No, ma'am.
Any other amphetamines?
Yeah, like Valtrex.
Okay. How old were you the last time you used Valtrex?
I would say about 23.
Okay. How frequently did you use that substance?
About once a week.
Okay. And when was your last day of use?
2020. 2020?
Okay. Have you ever used hallucinogens before, LSD?
I have, yeah.
Okay. How old were you the first time you tried hallucinogens?
21.
Okay. And how often did you use?
About once every week.
Okay. And when was the last time you did that substance?
About the same time I did the amphetamines.
Okay. So 2020. Have you smoked marijuana recently?
I have, yeah.
How often do you smoke?
Every day.
Okay, how old were you the first time you tried marijuana?
21.
21. Okay, and daily. How much would you say you smoked a day?
Probably about 2 grams.
2 grams daily. Have you ever used PCP,
No, ma'am.
ecstasy,
No.
ketamine?
No, ma'am.
Okay. Inhalants?
No.
Have you ever abused over-the-counter medication?
No.
Okay, steroids?
No, ma'am.
Okay. Do you drink caffeine?
Yeah, every day.
Okay, you smoke tobacco?
Well, I use a vape.
Okay. How many milligrams of nicotine?
Well, the vape is 50, and I probably, I'd say like 2 milligrams a day.
Okay. And how much caffeine intake do you have?
1 cup of coffee a day.
Alright, I'm gonna go through a list of just related symptoms, and I just want you to tell me yes or no.
Okay.
Cravings?
Yes.
Okay. Itching?
No.
Anhedonia?
No.
Okay. Tremors?
No.
Blackouts?
Yes.
Okay. Do you ever have guilt associated with your substance use?
Yes.
Okay. It's okay. You're in the right place.
Thank you so much. I'm grateful to be here.
Preoccupation, compulsive use.
Yes, yes.
Okay. Mood swings.
Yes, ma'am.
Okay. Do you ever have nosebleeds?
I do not have nosebleeds, no, ma'am.
Okay. Sinus problems.
No.
Chest pain.
No.
Okay. Have you noticed that you've had an increased tolerance the more substances you use?
Yeah. Yeah, I've noticed that.
Any nausea or vomiting?
No, ma'am.
Okay. Loss of control once you start using?
Oh, for sure. For
Okay.
sure.
Have you ever had a seizure?
Withdrawing a couple times, yes.
Okay. Have you ever had to stop? You tried to stop and you failed to?
Yes.
Okay. Have you ever just woken up and the first thing you did was use?
Yes, ma'am.
Okay. Have you ever experienced paranoia?
Yes, ma'am.
Okay. Have you noticed a decline in your hygiene?
Yeah.
Okay. What about loss of sensation in extremities like numbness?
I don't believe so, no.
Okay. Do you continue to use despite negative consequences?
Absolutely.
Okay. Do you ever become abusive towards others?
Absolutely.
Okay. Withdrawal signs after the last time you used?
Yes, ma'am.
Do you ever find that you're annoyed with others who complain about using?
Yes.
Okay. And then I want to go back to your primary drug of choice. When earlier you said it was alcohol,
Yes.
would you say that you use heroin more than alcohol?
Probably not more than alcohol, but it is a pretty big aspect.
Okay, what would you say your primary drug of choice is? Alcohol or heroin?
Probably heroin.
Okay, and then alcohol would be your secondary.
Yeah.
Okay. I always just like to ask for clarification, and that's what getting this assessment is about, is just seeing where you're at and what we can do to help.
Absolutely.
Okay. Do you understand that you do have a problem with substances?
I have realized that over the last couple of months. Yes, ma'am.
Okay. So do you realize that using heroin daily, that's a problem for you too, not just alcohol?
I do see some issues with it, yes.
Okay. All right. What is your longest period of abstinence?
Lately about 3 days.
Okay. What about in your lifetime?
About 3 days.
Okay. When did this occur?
I would say I tried to get clean about a week ago, and it only lasted about 3 days, and then I couldn't handle the withdrawals anymore.
Okay. All right. So what helped you to stay sober for those 3 days?
Just knowing that I have people that love me and that want to see me do better.
Okay. And you've never been to treatment before except for an intensive outpatient program.
Yes, ma'am.
Do you have any problems with like money? So gambling, lottery tickets?
I have a huge problem with gambling.
Okay.
It's just like any other addiction that I have. I'll spend all my money on it, the same place, the same time.
Okay, so like a casino,
Yeah.
maybe? Okay. And let me get a little bit of insight. I heard you mention earlier that you know what AA was and NA.
Yes, ma'am.
So you have a history of AA and NA.
I do.
When was the last time that you went to an AA meeting?
Probably last week when I had those 3 days clean.
Okay. And then you are currently employed, so how is your financials?
The financial situation is pretty rough. I work a really good job, I make really good money, and it seems to disappear before rent's due somehow.
Okay, how much money would you say that you make a month?
I'd say about $3,000.
Okay. And at the end of the month, how much would you say that you have left?
Zero, negative $15.
Okay. And does the majority of your paycheck goes towards buying substances?
Yeah, I would say that. Buying substances and then a good bit at the casino as well.
Okay. So tell me a little bit just about your thought process. So whenever you're thinking about going and using, does it occur like, I need to go right now? Or is it more of, well, I'll go here in a little bit?
It's always very obsessive compulsive. If I think about it, it needs to happen within like the next 20 seconds.
Okay.
So it's pretty like instant gratification. Like if I think about it, I need it now.
What would you say the majority of your thoughts are on? So for example, it could be obsession, you already said that. Do you ever think about hallucinations, delusions of reference? So like fantasy, right? I always like to say as someone in recovery, a number one drug of choice is fantasy for us. So like, are you thinking about this other life that you could have?
I think I'm more of trying to escape the life that I'm living.
Okay.
Like I don't want to be coherent of what I'm doing to myself or of my family, so I just keep using to perpetuate that existence of unknowing.
Right, right. Do you ever find yourself having like delusions of anything? Do you ever see anything or like have thoughts like hear voices in your head?
No, I don't have any hallucinations or delusions or anything like that. I'm pretty on plane most of the time.
Okay. How would you say your concentration is? Alert, poor? Are you easily distracted? Do you always find yourself preoccupied?
I pretty much always find myself preoccupied or distracted with something.
Okay. Can you tell me what your full legal name is?
Rachel Lee Stalby,
Okay. Can you tell me where we currently are?
Panama City Beach, Florida.
Okay. Can you tell me what time it is?
I'm gonna say like 7:54.
Okay.
I didn't wear my watch today.
And can you tell me why you're here for this evaluation?
I'm here to try to get some help and see what I need to do to start living the life I need to live.
All right. I want to just ask you a little bit about your past history. Have you ever had impulse control problems?
Mm-hmm.
Okay. What about like your insight? Have you ever had a situation arise where someone, maybe a friend or a close family member, was like, this isn't the way that you see it?
Yeah, that happens all the time.
Okay. Have you ever had any memory problems at all?
Oh, memory shot.
Okay. Do you have trouble remembering things like that happened recently, or trouble memory, like with your memories?
My memories.
Okay, so when you think back about your memories, are they kind of splotchy, have holes in them? Okay. Have you ever had any thoughts of suicidal ideation?
No.
Okay. Have you ever had thoughts of harming someone else?
No.
Okay. Have you ever had any thoughts of harming yourself?
No.
Okay. Have you ever assaulted someone before?
No.
Okay. So you've never been in a fist fight, never ran over anyone with a car,
Nope.
never held a gun to anyone?
Nope. No, I've never gotten that bad off in the 2 years that I was using. I see how it could get that way really quickly if you're using for, a couple more years than what I did. I could totally see how people could get there.
Scary, right?
Terrifying, yes.
Alright. Alright. So one of the things that I always just, like to ask is a little bit about what your aftercare plan. Okay, so as far as my clinical impression, I do believe that since you have already done intensive outpatient, I think you could benefit to going to an inpatient treatment center. There's a couple local places around. There's in Panama City Beach, there's the Keaton House. There is Journey Pure, which, as you know, you held a job there for quite some time.
Yes, ma'am.
There's also Recovery Bay and Florida Springs. Do you think that you would be open to going to an inpatient treatment center?
Yeah, from working at one, I could definitely see the benefits that people would have going inpatient. I think that's definitely an option that I should be considering.
Okay. So one of the things that I like to just ask is, do you have reliable transportation?
Sometimes. Sometimes
Okay.
I do. Sometimes.
Tell me a little bit about that.
So sometimes my car works, and then other times I can't be bothered to put gas in it or
Okay.
get it maintenance to be in a drivable condition.
Okay. And so after you complete this program that we're going to recommend you for, do you think that you like your current living situation, or do you think you could benefit from going to sober living?
Well, I traveled for work, so I don't really think I could go to like a sober living situation. 30 days to be able to go to inpatient, or the X amount, a number of days for that will be satisfactory.
What about just increasing maybe like the social support you have with other people who are also sober?
Yeah, I could try that.
Okay. And you don't currently have any legal concerns?
No, ma'am.
Do you have any educational or like employment stressors that you might need referral for, like maybe a new job?
Possibly, if it gets to the point, I'll have to talk to somebody about going away for X amount of days to an inpatient treatment facility and see kind of like where they stand and what they need from me.
Okay, all right. And then I think from everything else, it's safe to say that you're probably going to need help with finding a mental health provider, help finding support groups and a substance use provider, and maybe some help with financial concerns. Okay, so what I would like to do is I would like to refer you to an identification assistance agency, and they're going to help with placing you into treatment. And so through them, we will create a safety plan for you And we'll just do an assessment to just make sure your living situation is safe. But the recommendation I'm going to make is initiating group therapy and individual therapy at an inpatient treatment center for 30 to 45 days. And when you get done there, I would like for you to participate in a 60-minute group therapy session that will be virtual since you travel for your job. And, you know, I want to check in with you periodically throughout this process to make sure that you are getting what you need. Okay?
Yes, ma'am.
Do you have any questions?
I don't, no.
Okay. How are you feeling? Do you feel scared?
I feel really nervous.
Yeah.
About, you know, major life changes, what my job will say, what my partner will feel like, the financial situation, like, am I gonna be able to afford my rent if I don't work for 30 days, like, how exactly am I gonna, like, continue with all of these obligations that I already have if I'm gone for 30 days?
Let's look into some assistance programs together to see if we could get you FMLA possibly, so that you'll be able to pay your bills, and we'll see if I'll work with your employer's human resources, because I think without getting sober, you know, how will you continue to hold a job?
Absolutely. Yeah, I can totally see where you're coming from.
But I'm very excited that you reached out to get help. All right.
I am also excited. Thank you so much. This has been a great opportunity.
This is the end of the video. So as you'll see at the beginning of the assessment, my client struggled with alcoholism. And the more questions that we asked, the more we figured out that she had other substances. And I think this is very common during assessments and during role play exercise, that the more rapport you build with a client, the more truthful they become. They feel more connected to you. You did a great job playing the client.
Thank you so much.
Thank you. And so our final conclusion is, or our recommendation or action plan, as you can see, is we are recommending inpatient treatment, especially since our client is using heroin, opiates, marijuana, and alcohol on a daily basis at such a high volume of substances. We want her to be under medical observation, and after treatment we want to build a continuing care plan with recommendations of 90 meetings in 90 days, obtaining a sponsor, going to Alcoholics Anonymous, going to Narcotics Anonymous. We are also going to recommend individual therapy along with group therapy on a weekly and bi-weekly basis. Anything else that this client needs, we will help to get that to her. Thank you so much.